Welcome to the Pregnancy Information Webinar for international students. This webinar was organised by the International Student Engagement Team. My name is Ibrahim. The International Student Engagement Team helps support international students throughout their journey at the university. We can provide you with confidential support and refer you to other support services if required. We also organise events for international students such as orientation and this pregnancy information webinar. If you have any questions or you have any issues that you'd like assistance with, please send an email to iss@monash.edu. You can also call us on 9905 6267. However, because we are working remotely due to the COVID-19 pandemic, that number will not be managed for the time being. Please send your email to iss@monash.edu and we'll get back to you. In this webinar, you'll hear from Dr Rimma Medres from the University Health Service talk about preparing for pregnancy. You'll hear from Kushal Shah from Allianz Global talk about overseas student health cover, and Leanne Harvey from the City of Monash talk about maternal and child health services. And now introducing you to Dr Rimma Medres, who's going to discuss preparing for pregnancy.
So my name is Dr Rimma Medres. I'm one of the GPs at Monash University Health Services. And I've been asked to tell you about how the medical system works in Australia to help you navigate it. So the biggest question and the biggest concern is what will this cost me? So there are two different arms in our medical system. One is the private health and one is the public health. So your insurance is like our private health insurance. It covers the cost of your presence in the hospital. Whatever hospital fees arise as a result of that is all covered by your health fund. What it doesn't cover is the cost of the doctor. In the public system, your overseas health insurance will cover all the costs, except for some of the tests. So that your insurance acts as our Medicare system, and our Medicare system decided that some tests are not medically indicated or compulsory, as we call them, and so they don't cover. So the Medicare doesn't cover it for Medicare card holders, and so it doesn't cover it for you either. So these are extra tests that we will talk about once you are pregnant, and we need to discuss whether you have them or not. So I won't go too much into it because it's too complicated. So the private care. So why have private health insurance? Why go with the private system? So if you go privately, you can choose which hospital you go to. You can choose which doctor you want, and you go into it knowing that there will be out-of-pocket fees. So these out-of-pocket fees will be for the tests that are non-Medicare rebatable, for the obstetrician, and if you need an anaesthetist. So you would need an anaesthetist if you have an epidural or if you have to have a cesarean section. The obstetrician cost is about $3,000 to $7,000. It depends on the doctor, and your health insurance does not cover that. So other investigations that are usually involved in the antenatal period can go for, you can expect somewhere between $500 and $800. That's whether you go with the private care or not. And the anaesthetist also costs about $500 to $800. In the public system, the standard of care is exactly the same as the private system. They follow the same guidelines, the same rules. You're not a second-class citizen by any stretch of the imagination, and you don't have to worry about the kind of care that you're getting. You don't get a choice of the doctor. It's basically whoever is on the day. If it's a boy, it's a boy. If it's a girl, it's a girl. And in the hospital system, you may not see the same doctor twice. You do not get a private room, which some of the private hospitals guarantee. And but your cover will cover for everything, no matter what you need throughout your stay in the public system. The out-of-pocket fees again arise from the non-compulsory, non-Medicare rebatable scans. Within the public hospital system, there are also different types of care. So the first one is midwife only. So that means that so you're looked after by the midwife only. There's one midwife that looks after you usually throughout your whole pregnancy. You see them for all the compulsory kind of visits throughout the pregnancy. There's about 10 of them. You will see a doctor once, and basically it's for low risk pregnancies, and if anything develops throughout your pregnancy, then you may be transferred to the doctor model. There's basically low to no intervention in this arm, and your health insurance covers all of that. Then there's the shared care model, and that's where I come in, or the likes of me come in. So there are 10 visits that are scheduled throughout the pregnancy, and you would go to the hospital for some of them and some to the GP. One thing I didn't cover is that the public hospital that accepts international students is the Royal Women's Hospital. Monash Medical Centre does not accept international students. It's a political decision. I don't know why. That's just what they've decided. And so in order for you not to go all the way to the Royal Women's Hospital every time, and to develop a relationship with the GPs whom you can see after you have your baby, this is what the shared care model is about. So usually they see you somewhere around the 15 to 18 week mark face-to-face, but because of the COVID, which I will talk about at a later slide a bit more, they have changed their schedule. Although the way that they're doing things at the moment, they're not following their own schedule. So I'm really confused, but we just have to play it by ear. So the 10 appointments are scattered between the GP and the hospital. And sorry, my lights go off. And usually in the first trimester, you would get seen by me only. And then the hospital comes in and we do shared care model. The appointments with me are covered by your insurance, and the outpatient appointments with the hospital are covered by your insurance. Now, in women who are considered high-risk pregnancies, who have had complications in past pregnancies, who have medical conditions that predispose to potential complications, who have had and who develop problems while they're pregnant, they may be transferred to hospital-only care. So we have only partly kind of influence as to whether you can go to the shared care or to the midwife-only care model. The hospital is the one that has ultimate decision-making power. And if they decide that you are too high risk for them, then they will take over and not let you go and see the GP. At the end of the day, they're the ones who are going to deliver the baby. So it's only fair to say that they have the veto power as to whether they look after you completely, or I get some say in it. Right. So, which hospitals accept overseas health insurance? So the Royal Women's Hospital, which is in the city or in Parkville, they have a smaller hospital that's affiliated with them. It's called Sandringham, and it's in Sandringham. If you live in the eastern suburbs, then Eastern Health or Angus and Box Hill Hospital accept international students. The process is very annoying and very cumbersome, but it's doable. And all private hospitals accept international students. They all need to know that you are pregnant and that you exist, and the referral has to come from us. So you have to come to see the GP and get a referral, and we will explain to you what happens next. So when do you come to the doctor? If you're newly pregnant, come and see us. If you're not booked in with a hospital, come and see us. If you're thinking about starting a family and you want to ask some questions, come and see us. And if you have a chronic medical condition and if you're worried that it's going to affect your pregnancy, please come and see us. We will talk you through things. I don't know what that happened, but if you have been trying for more than 12 months without success, please come with your partner. What will happen at the first appointment? At the moment, because of the COVID situation, the first appointment is more likely to be over the phone. So you will probably talk to a doctor who will arrange some blood tests and an ultrasound. And then you will have an appointment made face to face, but probably by the doctor. And then you will come in and you will have your blood pressure checked and you'll get examined. Your stomach will get examined, your weight will get checked. And basically, anytime you see a doctor face to face, you will have a blood pressure check, your tummy poked, your weight measured, and it will be discussed whether you need tests or not. Then we will decide where to refer you. And these are the tests that this is basically the test that you get throughout your pregnancy. So you get an ultrasound at about 7 weeks and a blood test around the same time. That's to confirm the pregnancy and screen for common medical conditions that can affect the pregnancy. At 12 weeks, you have an ultrasound for early anatomy scan. It can be incorporated in the Down syndrome screening, or it doesn't have to. And at 20 weeks, you will get an anatomy scan. So basically, that's how the baby is developing. That one is, so the 7-week scan is rebatable through your insurance, and the 20-week scan is rebatable through your insurance. The 12-week scan is not, because it's deemed non-compulsory. But most of obstetricians prefer for you to have it, and I prefer for you to have it. But if it is astronomically impossibly expensive, and you don't want to have it, that's fine as well. So the blood tests are done in the first trimester, so around 7 weeks. Then the Down syndrome screening, which is also a blood test at around 12 weeks. Then there's a blood test at 28 weeks, which screens you for diabetes. Then there's a swab, a vaginal swab at 36 weeks, and that's pretty much it. That's that. Now, I'm going to have to see if there's any questions. What am I doing? Q&A. So the first question is, I was informed that Medicare recently changed policy of ultrasound scan. Mostly it is not covered. Is it true? So Medicare partially covers the scans, basically. There's usually an out-of-pocket fee. I don't know what it is. It depends on the provider you go to. So there are some providers which are known as women's ultrasound, so ultrasound for women only. They scan only women who are pregnant, and so they have better scanning, and it's done by a person who's specifically trained in checking the baby, so they can pick more things up. Usually I push for those. I say that your money is better spent going to those places, but they need time. And because of this whole COVID situation, everybody's trying to limit the amount of time that they're in the same room with you. And so I'm getting scans that are not doing things that I want them to do. So at the moment, I'm not pushing for it. But in general, that's what I push for. No, I guess push is a bad word. So encourage you to go to those places. If you go to a place like IMED or Capital Radiologist, which is just a general radiology place, they still do these scans. They still know what they're doing. They still cover all the important parts, but they don't do some things that the ultrasound for women do. And so they don't cost as much, but there is still an out-of-pocket fee. It depends on the stage of your pregnancy as to how much out-of-pocket it is. And no, there are no monthly ultrasound checkups. Your insurance does not cover it. We don't so in the public system, they don't do monthly ultrasounds. In the private system, some obstetricians have an ultrasound machine in their room. And so they have the ability and the training to basically put you on their couch, scan the baby, and that's how you do it. But in the public system, there's no facility for that. And in general, so when I go to my updates, the private obstetrician generally have 5 scans that they do. But they do it, again, they do most of them in their rooms, and only 3 of them are the ones that I mentioned at 7 weeks, at 12 weeks, and at 20 weeks are the formal ultrasounds. If you want to have an ultrasound, you're welcome to have it. It's around about $300 every time you have one. You can have one every day if you want to. I just don't see the point. There's no, so mandatory is, so somebody's asked how many scans are mandatory. There's no such, we don't mandate anything. It's recommended to have the 20-week scan to make sure that the baby's organs are developing. And it's recommended to have a dating scan around 7 weeks, which means that we can see that the pregnancy is going according to, like, it's progressing how it's supposed to. And the best time to estimate the date of delivery, or the estimated date of delivery, is earlier on in the pregnancy. So the smaller the pregnancy, the better we are predicting when you're due. But it's always an estimated due date. It's never, yes, you're going to deliver on that date. So I guess the minimum number of scans, ideally, from a doctor's point of view, is the 7-week scan and the 20-week scan. The 12-week scan, which screens for abnormalities related to Down syndrome, and it also screens for various other things that can arise throughout the pregnancy. So in my book, I would like you to have the 7, the 12, and the 20-week scan. But the 12-week scan is deemed non-compulsory, and so therefore it is not Medicare rebatable. It costs around $350, and for some people it's just prohibitive. Most of you guys are young, you're fit, you're healthy. There's really no need to freak out and have an ultrasound every 5 minutes. And you know, in some countries around the world, there are no ultrasounds, and they do fine. So I guess at the end of the day, we have to balance out what the guidelines are and how much we are paranoid about things. Okay, so that's the questions I've got so far, and how to prepare for, so this is my next bit, how to prepare for pregnancy. So, why are you not doing this? Okay, so ideally, for 3 months before you get pregnant, you should have some folic acid. Folic acid prevents neural tube defects, which is basically it helps. High dose of folic acid in the system of the mother decreases the chances of any problems with the formation of the spinal cord. It's been proven multiple times. It's very cheap and very easily accessible. And we're currently also recommending iodine. So Blackmores make specifically a folic acid and iodine tablet. And basically it's just 1 a day, ideally for 3 months before you get pregnant. But if you get pregnant, if you just found out you're pregnant, we start this as soon as possible. If you go to a pharmacy and say, I want to get pregnant, they will sell you the expensive stuff. So expensive stuff is Elevit. Elevit is a multivitamin that's really good for pregnancy. There's absolutely nothing wrong with it. It's just really expensive. So if you want to, when you're pregnant, we recommend that you do have the Elevate, but before pregnancy, folic acid and iodine are sufficient. So optimize your weight, eat well and exercise. And if you come and see us before you get pregnant, we will check your immunity for chickenpox and rubella, which is a blood test. We can then immunize you if your immunity is insufficient. And it's not recommended to be immunized with these while you're pregnant. So it's best to do it for two months before you start trying. So it's best done before you start trying. If we do check for immunity for this while you're pregnant, and if this is low, we will just tell you what to do, but we would not be immunizing you against this while you're pregnant. And we're also finding that in our population, vitamin D levels are very low in mothers, especially mothers who wear a veil. And so this is affecting bone formation in the baby. So we would check your vitamin D level, and 9 times out of 10 would tell you to take a supplement. If you have any questions or worries, please come and talk to us. That's basically my message about anything to do with medicine. The GP is your interpreter for the medical system. So come and use us. That's what we're here for. If you want a book to read or an app to download, this is probably better for when you are pregnant already. What to Expect When You're Expecting is a really good book. Up the Duff is also it's an Australian comedian wrote it. It's very factual, but it's also got a lot of Australian humor, which doesn't always translate to everybody. What to Expect When You're Expecting is not funny. It's just factual. Royal Women's Hospital has come out with an app. It's called Growing Together. It's okay. I think the pregnancy baby tracker is better, but it's American, and they have a lot more. They push for a lot more scans and a lot more tests, because in America the medical system is all based on how much tests they do. So in their book, the more tests the better. So just be careful of what they recommend. Baby Central is a website which is also American, which is also heavy on investigations. And the other thing is that both of these promote a lot of things. So there's a lot of ads. Now, a lot of people ask me, how do I know I'm ready? So this is just for a bit of comic relief.
Paging sanity. If you're watching this and you don't have children and you're wondering, am I ready to have kids? Here are some signs that you're ready to be a parent. Hello? First of all, you hate sleep. You hate it more than you hate paying your taxes, more than root canals, more than enemas, more than bleeding out of your eyeballs. You hate sleep. And when you finally are asleep, you can't wait for some little cutie pie to come wake you up and put their feet in your face and ask you for a 5th cup of water. If you hate sleep, you're ready to be a parent. You love loudness at all times. Afternoon, morning, 3 a.m., 4 a.m., 4:15 a.m. You love loudness. You're ready. Be a parent. Have kids right now. For the next 18 plus years, are you ready for someone somewhere at all times to think that you are doing it all wrong? Whether it be fellow parents or your teenagers or those people who aren't parents but are going to tell you how to parent. If you're ready for a bunch of unsolicited opinions and judgments, it's baby time. Hi, doctor. Can I have a shot of patience? If you just love the idea of having a debilitating sense of guilt at all times and not even knowing why, go get knocked up. Just leave it in there. Here's another sign you're ready to have kids. You love that shabby chic distress look. No, I'm not talking about your furniture. I'm talking about your appearance. You love looking like someone took an electric sander, sanded the crap out of your entire body, and then threw some stain on you. That's sexy. Do you enjoy wiping stuff? Counters, noses, butts, penises? Are you a big fan of bodily fluids? Not just touching them, but stepping in them, wearing them, maybe even ingesting them? Time to pick the nursery color. It's not coffee. Paging sanity. Here's another one. You enjoy repetition. Yeah, you love singing the same song 100 times a day. You love reading the same 4-page book 1,000,000 times over and over again. You love hearing the same word, mom, 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 all day long, saying the same word, no, 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 no. Listen, if you are capable of saying the same thing, singing the same thing, watching the same thing, playing the same thing, answering the same thing, doing the same thing over and over and over and over and over again without completely losing your mind, you are ready to be a parent. Never answers. But most importantly, you are ready to be a parent if you are not a wuss. You are ready to be blown away by your own strength, to worry every single day and yet never allow that worry to paralyze you, to accept that you will never be perfect at this one thing you so badly want to be perfect at, to not beat yourself up over the fact that you don't love this new role every second of every day. If you are ready for the greatest, most challenging, most heartbreaking yet heart-filling, beautiful adventure of your entire life, that's when you know you're ready to be a parent.
When is it the best time to have a baby during a PhD? I don't know how to answer some of these questions, but I thought I'd put them up there because I think everybody has the same questions. How to handle having a baby when you are a PhD student and your partner is working. Where to get financial support. What is available to international students? There isn't much. And usually I would tell you to import your parents or a support person. But in the current climate, it's very difficult to. So you have to take that into consideration. It's also difficult to travel back home to have your baby. Some people are having more luck than others. So you have to take all of those things into consideration when you're planning to have your baby. The cost of having a baby. Are international students eligible for childcare on campus? You can access childcare on campus. There's just no subsidy for it. What are the costs of having a baby? So vaccinations are free. They're covered by our government. Childcare is on you. The options are the same as for everybody else. So you can hire a nanny, you can go to a childcare center, but that will all be on your expense, at your expense. How to prepare for conception. So folic acid and iodine, as I said before, come and have a talk to me and we'll talk about it. What if there are problems with conception? So generally, we like you to try yourself for 12 months. If you're having problems beyond 12 months, please come and talk to us. And how to talk to your supervisor about leave. Look, I don't know how you talk to your particular supervisor, but I am happy to provide whatever documentation you need for the purpose of you getting time off. And I wanted to put this in. So during this COVID-19 crisis, we are open. So the Monash University Health Services are open. We're open at all campuses. We have a dedicated COVID testing clinic, which we call the Fast Track Clinic at Clayton. So if you are worried that you may have symptoms of COVID-19 and you want to get tested, we can provide that on campus. At the moment, when you try and make an appointment, you will be directed to have a phone appointment first, so a telehealth appointment. We all have Zoom capabilities, so you can do a video appointment. I probably do 50-50. This is how we've decided to keep us and the patients that do come into the clinic safe. We talk to you about why we need to see you and decide whether we need to see you, but we will see you if need to be. You will just not see our faces because we'll be hidden behind masks and goggles, and we're all in scrubs, and it's very different to how we used to do things, but this is just the way of the world at the moment. I don't know when it will end. So if you are pregnant, by the current guidelines that are provided from the hospital, I am supposed to see you at 28 weeks. And then they prefer for you to be seen at 32, 34, and 38 weeks as well for certain measurements, which cannot be done on telehealth. I don't know, the hospital is currently not following that guideline, so they're kind of doing it ad hoc. So I'm just following whatever they decide. If you're worried about something, I will see you. If there's any complications that arise, I will see you. It's just, you'll probably need to speak to me on the phone first. There are restrictions on visitation to the hospital. At the moment, the hospital are allowing one partner during delivery, one support person. They're not, I don't think they're allowing partners to come to the appointments. They're trying to minimize the number of people who are attending the appointment. If you're worried about your English level skills and you're worried that your partner needs to translate for you, the hospital has the ability to arrange a phone interpreter if needed. So we can work around it, but mainly just know that when you are in the hospital, they only allow one person in, and they will limit the amount of time that that person is allowed to visit for. Everything is a little bit crazy at the moment. We're hoping it'll settle. We don't know when, but that's the situation.
Thank you, Dr. Medres. If you would like to make an appointment to see Dr. Medres or any other doctor at the University Health Service, please go to this website for contact details. Up next is Kushal from Allianz OSHC.
Hello, everyone. My name is Kushal Shah. I'm the key account manager at Allianz Overseas Student Health cover. We've been joined by Tula Leah. She's the sales and service manager at the Allianz Global Assistance as well. I'll go through today Overseas Student Health cover, what you need to know, and what is the relationship for Overseas Student Health cover when you're pregnant. If you have any questions, as Ibrahim said at the start, make sure you put it in the Q&A, not just in the chat box. And Tula will be able to respond back to individual questions in the Q&A session. Okay, I will dive straight into it. Okay, so what is Overseas Student Health cover? There are three types of covers. There's single, there's dual family, which can be husband and wife, or a single parent with one dependent child, one or more dependent child. And a multi-family cover covers husband and wife and multiple kids. Okay. So there was a question was asked on the chat box: is there a cooling period for taking an insurance? For X insurance covers, the charge is only after I've spent 1 year in Australia with OHSC cover, or we can get the cover if I get pregnant in the first year. Now, okay, so there are two types of covers you can get under the Overseas Student Health cover. It's exactly same as Medicare, which is given to Australian citizens and residents. Okay, it's no different. So you're not considered, as Dr. Rimma mentioned, you're not considered second-hand citizens. You get this exact same cover as what an Australian citizen and resident will get. Okay, so there is an Overseas Student Health cover deed, but guided by Department of Health. Under the deed, there's a 12-month waiting period for pregnancy when you arrive in Australia. Okay, so when you first arrived in Australia, you have to wait for 12 months as per the standard cover under the OHSC policy. What is different for a Monash Allianz Overseas Student Health cover policy is we will waive off the waiting period. So if you have purchased your Overseas Student Health cover from Monash University via your offer letter, we will cover the pregnancy from day one. Okay, even if you're pregnant and you come pregnant from overseas, that will be also covered. We won't consider that as a pre-existing. okay, it would be covered from day one. But that needs to be purchased via the offer letter on when you first arrive in Australia. Okay. The other types, there are other types of, so there are agent policies. So your education agent back in your home country would have sold you a policy, which is not the Monash Allianz policy, or there can be other providers policy like Medibank and IB Bupa. Now, those policies also don't cover pregnancy from day one until they have a special condition on the policy. Okay, only Allianz Monash policies will cover pregnancy from day one. Okay. Okay. Now, the next slide is what are the types of pregnancies we see? So there is shared care, which is which basically Dr. Rimma explained that in detail. So that can be shared. So duty of pregnancy can be shared with a GP, your general practitioner. Okay. The other second option is obstetrician in public hospital. Again, as Dr. Rimma mentioned, that is also covered, but it's again only in the public hospital as per the regulated guidelines under the pregnancy. Okay, and there is private obstetrician. Again, remember this: if you're going through a private obstetrician, there is certainly a gap fee. Okay, anything you go in private, if you go through a private clinic or a private part of the hospital, they will certainly charge you a gap fee, which you need to pay that out of your pocket. Again, as Dr. Rimma mentioned, if you don't have to do scans every second week or every month, don't do it. If that's the case, again, if you want to do it, that would be a gap fee which you would need to pay outside your pocket. Okay. Okay. The next slide is choosing your hospital. So Allianz Overseas Student Health cover, when we would want to know, as soon as you fall pregnant, please come and see us or inform us. At the moment, we are not based on campus, but usually in our post-COVID-19, once everything opens up, we will still be based on campus at the Monash Connect. Please come and see us or give us a call and let us know as soon as possible that you're pregnant. Okay. What we can do then is we can assign a case officer for you as a patient, and that case officer will take you through for the entire journey of your pregnancy. They will contact you every month to let you know what is covered, how things are going, and just checking on you. Okay, so please make sure you let us know as soon as you know that you're pregnant. Okay. Also, there is private patient in the public hospital and private patient in the private hospital. Now, there are so OHC, as Dr. Rimma mentioned as well, Monash Medical Centre in Clayton, they don't accept OHC patient in the public ward. They would still accept you guys in the private part of the hospital, which basically means that you would need to pay a gap fee out of your pocket. They're private hospitals for a reason. Again, private hospitals are covered and public hospitals are covered for the exact same claims, okay? But they would be only covered the best way to remember, they will be only covered for the MBS fee or the government part of the fee. If there is a private fee on top of that, that would need to be paid outside, out of your pocket. Okay. There is other options like private hospital as well, where you can go to a private hospital and be admitted in the private hospital, and they have a bulk fee, or they give you a package fee, which you again would need to pay that out of your pocket. Okay. How do you inform Allianz when you're pregnant? Okay. What I would do is I'll go through the I'll take you through the website so you know. Okay, so this is our website, allianzassistancehealth.com.au. Okay, currently we have information on COVID-19, so if you need any information on that side as well, you can click on the links here. Okay, there are two things I would like to take you through. So first thing is find a doctor, which is, you can just click on find a doctor tab on our website. Okay. we would highly recommend all Monash students to go to Monash University Health Services. They're the experts. They know international students really well. They can guide you through in the right direction, and also there's no gap fee, which means you don't have to pay anything out of your pocket. You just have to show your card, and the bills will be redirected back to us. Okay. If you can't make it to the Monash University Health Services, you can go to our website, go to find a doctor, go to student visa holder. Okay. Just let's type in Caulfield. Okay. And when you click on Caulfield, all the doctors we work with, they'll be here. Now, there are multiple options where you can filter down. So you can filter down on type of languages doctors do speak. So if you want to say, for instance, have a doctor in, let's say Arabic, okay? A doctor in Arabic, okay? And you can then drill down to what type of doctor. So I would suggest you to most of the time see a doctor with no gap fee. What that means is you don't have to pay anything out of your pocket. You just show them the card and they will send the bills to us. Okay, click on that, and all the doctors around Caulfield who speak Arabic will come up right at the top. Okay, then you can click on that Burwood Healthcare, for example. You would know what's their address here, what time they're open. They have male and female doctors, Arabic, what sort of languages they do speak, which is quite a few here, and their website details as well. Okay. Also, make sure when you contact, so you need to call them to make an appointment. When you do call them, again, double check with them that I'm an Allianz Overseas Student Health Cover member. I just want to double check there's no gap fee for the consultation, and they will confirm that. Okay. The other thing you can do is also there is a pregnancy care. So you can click on pregnancy care, and doctors around the Caulfield area with pregnancy care will come up. So Caulfield is the biggest one we have is Monash University Health Services Caulfield for Monash staff and students only. So you can actually go there and they won't charge you a gap fee. There's no gap fee for them. Okay, and there's pregnancy care too. So you can actually drill down to what type of services you require. Okay. Also, the next bit I wanted to show you was how do you inform Allianz if you're pregnant. So you need to let us know as soon as possible with a treatment guarantee. So when you're actually going through the hospital, okay, we would need a form which would need to be filled in called a treatment guarantee form. So you just go to a help center, click on OHC Help Center here, okay, and you can just type in treatment guarantee form and just search. And there's the form, it's the first form right at the top. You can click on it and you can actually fill that form down here, okay? Which will, so basically just fill up the part A, which is the patient details. Part B would be either filled by a treating GP or it would be filled by the hospital, okay? And once it's done, you just have to email it across to ohsceligibility@allianz-assistance.com.au. All the information is just right there at the bottom of the screen, okay, at the form. So if you have any questions regarding this, come see us on campus or give us a call at this time and we'll be able to assist you, okay? And the number is 1-800-884-526 and option 1, and then again option 1. It's all on the form. Information's there on the form. Okay. It's called, again, I'll repeat this. It's called treatment guarantee form. This form is required before you go to the hospital for the delivery. Okay. We would need this form to be filled in. Okay. All right. I will take through the next slide. I've just gone through this. So how do you find a doctor? Now, finding a doctor is now quite easy. You can go through the Find a Doctor tab on our website. We have other services called Doctors on Demand, which I'll go through in the next slide a little bit, what those services are, okay? You can have a video chat with a doctor, and you can even call a doctor to come to your house. Now, Find a Doctor can be also done on our website, so through the phone. So you can click on this icon, where it would take you through Find a Doctor tab. Okay. Can you see my screen? It says it's paused.
We can, yes.
Yeah, okay, sorry. Just the flipping off the screen. So I'll just go through the slides again, sorry. Okay, so you can find GPs, you can find different types of doctors. Again, you can, as I showed it on the website, you can find a doctor, you can speak to a doctor over the phone through Doctors on Demand at no extra cost, which I'll go through more in detail on the next slide. There is video chat with a doctor through Doctors on Demand. You can even get a doctor to visit to your house after hours. But we would, again, highly recommend you to go to Monash University Health Services if it's reachable within the distance from your house. Okay. Again, you can even find a doctor through the phone. So you can click on this icon so go to the website, find the doctor. You can click on Find a Doctor tab right at the top. Okay, which will come up with exactly the same as what I showed on the website. Just put in your postcode and all the doctors with Allianz will come up here. Okay, you can then filter as per your requirements. There is a Doctors on Demand, a telehealth services free of cost to all Allianz Monash members at no extra cost. You don't have to pay anything out of your pocket. You can call the doctor every single day and we will pay for it. Okay, you can even call a doctor to come to your house as well. Okay, so what is Doctors on Demand? So Doctors on Demand is a telehealth service which is provided to all Allianz Monash students and all Allianz members across the board, where you can go to Doctors on Demand. You can click on Redeem a Benefit. You can enter your membership number. Again, remember your Allianz policy number. If you have purchased the policy via the offer letter when you started with Monash, your policy number would be same as your Monash student ID number, followed by MON, the first three letters of Monash. Okay, that is 99% of the time would be a policy number, unless you're a sponsored student or an OZ student, that would have a different suffix at the end. But your policy number will start from your student ID number. Okay, if you have purchased through the offer letter. You can also book in a consult. So once you enter your membership number, you can book in a consult or request a repeat prescription. So for example, I do get really bad hay fever, okay, during the springtime and the autumn times. If I need to get antihistamines, I can actually call Doctors on Demand and ask for a prescription a repeat prescription for my antihistamines. What they would do is they would send a prescription to the nearest pharmacy from your house. Okay, all you have to do is go there, pick up the medicines, and off you go. So I would encourage all the students to use Doctors on Demand as a triage service. If you're not sure if it's an emergency or not, and if it's after hours and the medical center on campus is shut or you don't know what to do, call Doctors on Demand. They're professional Australian-based doctors who can assist you through, and if required, they can triage it to 000 and call an ambulance for you to go to the hospital. Okay. All right. You can download the app as well, and it's certainly on the website through Google Play and App Store. Okay. We can also we also work with doctors who can visit to your house, but it's only after us. We work with 136, which is National Home Doctor Service. There is another provider called Dr. You can also contact them and we directly bill with them. So they can come to your house depending on where you are. It can take a few hours for the students to come, for the doctors to arrive to your house. Okay. Okay, what your OHSC policy covers, okay? Let me just go through many questions. No, so what does your OHSC policy cover? Okay, so it covers GP costs. So this will explain to you exactly what your coverage is with the Overseas Student Health cover policy, okay? So we cover doctors and specialists. All the doctors are covered up to 100% of the MBS fees. MBS is called Medicare Benefit Schedule. Every consultation, if you go to see a doctor or GP, will have an item number. If it has an item number, that is covered. Okay, so it is covered up to 100%. The best way I would remember this is MBS fees is a government fee. Okay, if there's a gap fee, there's whatever is on the top, it's called private fee. That's how I tell my students to remember. So anything which is over the government fee, if you have to pay that out of your pocket, that is called a gap fee, which is an out-of-pocket expense. Okay, specialist, again, they're covered up to 85%, but again needs to be referred by the doctor. Okay, hospitals, yes, they are covered for treatment and accommodation. 100% of the MBS for medical services provided in the hospital is covered. Okay, public hospital certainly is covered, as Dr. Rimma said, and she explained that really nicely. Public hospitals are exactly like our Medicare card, and private hospitals are like our private medical insurance or private health insurance. Okay, if there is a gap in public hospital, there most likely won't be a gap fee. You don't have to pay anything out of your pocket. Okay, but there's only limited beds in the public hospital. So the earliest you advise us, earliest you can book in a bed for the delivery. Okay, so again, it's always recommended for all our students to come advise us as soon as possible when you're pregnant. But private hospitals, they're again covered exactly same as public hospital, but there is likely to be a gap fee which you need to pay out of your pocket. Okay. Emergency ambulance, unlimited emergency ambulance is covered up to 100%. So if you need to have, if it's an emergency, you need to call ambulance to go to the emergency department in the hospital, that is certainly covered as well. Okay. Prescription medicines, they are covered too. Usually we cover prescription medicines up to $300 for single per calendar year, up to $600 for family per calendar year, but they need to be prescribed in the PBS list, which is Pharmaceutical Benefit Scheme. Okay, so there is another list where medicines are listed by Department of Health. If it's listed under that, that would be covered. Pathology. Again, that's same as the specialist, pathology, radiology, both are covered up to 85% of the MBS fees. Okay, surgically implanted prosthesis, they are covered too. Again, 100% of the minimum benefit on the federal government's prosthesis list. Okay, that is covered too. Okay, what your OHSC policy does not cover? So it does not cover assisted reproductive medical services like IVF, okay, antenatal classes, it won't cover. Your partner's accommodation or dinners, sometimes the hospitals do charge for your partner when the delivery, in the first few weeks of your delivery, when your partner wants to stay, the hospitals do charge your partner for the cost. That is not covered. Okay, some hospitals don't charge, some hospitals do. If they do charge you, then it's not covered. Television hire, mostly that happens in the public hospital. You have to hire a television to watch. If that is the case, that is not covered either. Okay, that is an out-of-pocket expense. Okay. Remember, again, this the contact details for us. So we are available 24/7 on 136742. Just give us a call if you have any questions. You can email us as well on ohsc@allianz-assistance.com.au, or you can even go to our website, which I showed you guys in the middle of my presentation, to get any information you require. Okay, that is from me. Any questions? Okay.
Thank you very much.
I'm just going through the Q&A and I don't see any specific questions on OHSC. Okay, I just have a question. We have from an anonymous attendee. We have OHSC dual family, and we're expecting our first baby. When we should upgrade the policy and what are the costs? That's a great question. Up to 60 days. You have to let us know within the 60 days, and we will upgrade that cover for you. Okay. Again, you can come and visit us on campus, or you can contact us via the phone, and we're happy to upgrade your existing Monash Allianz policy. Thank you, guys. Thank you for your time.
Thank you, Kushal. If you're not with Allianz, then please contact your OSHC provider for further information. Doctors on Demand is an online doctor's service which is covered by Allianz OSHC. "136" and Doctor are after-hour home doctor services which are also covered by Allianz OSHC. Up next is Leanne Harvey from the City of Monash.
Okay, so hello everyone. So my name's Leanne, and I'm from the Maternal Child Health Service at the City of Monash. Now, just because I'm at the Monash, across Victoria, we have each council will have their own maternal child health service, and they will be able to do a very similar program to what I'm going to go through today. So I'm going to be talking about once you've had the baby and what support you can have post-delivery. So this is one of our most important things. Our service is free. So all of what everyone else has been talking about, all the costs, our service is actually free to all parents living in Victoria with a child aged between birth and 6 years. So we have what we call our key ages and stages. So we have 10 visits that we set up. So our first visit being at birth, right up until they're ready to go off to school. So with our visits, we have, when you give birth in the hospital, they will send your local council a birth notice so that we are aware that you have delivered, and we will then contact you. If you're not contacted by someone within about a week of coming home, it's a good idea just to contact your local council and just let them know you're there. Sometimes things do get mixed up and they send the birth notice to the wrong council, so it is important just to let us know if you haven't heard from us. So at the moment, we are doing most of our visits via either video link or by telephone. We are in the next few weeks, probably about mid-June, starting to see our little babies back in the centre, but our older babies will still be by phone for quite some time. So as you can see by this slide here, the first 7 visits, so right up until they're 1, are all done quite quickly. And this is when things are changing the most and you're needing the most support as new parents as well. The last 3 visits, we do spread them out, and we do see you around 3.5 to 4 when they're going off to the schooling programs. Now, we are funded up until the age of 6, but we usually only see you past 4 if there are problems. So in Victoria, we have qualifications. So we are all nurses, we're all then midwives, and then we've gone and done further study in children and family health, which is our maternal child health. So we're here to help you navigate the rocky road of parenthood. We know there's no such thing as being a perfect parent or child, and we all hit road bumps along the way. So we're here to help you navigate these and help you to get through this quite difficult time. Thinking back to Dr Rimma's video about when we're ready to have a baby, there's no such time as being ready, but it is such a rewarding thing, and we hopefully will help you through all those hard times of being a first parent. Now, we're not a 24-hour service. We operate Monday to Friday. Some councils do have some Saturdays, but at Monash we are only open Monday to Friday. So we have our maternal child health 24-hour line. So you can contact this number 24 hours a day and know that there's going to be one of our nurses on the other end that can help you with any questions you might have. They will then contact us if they think we need to follow you up. We also have our maternal child health app, and we encourage everyone to put this on their phones. It has lots of information at your fingertips, and it will remind you when immunisations are due and when our next visit is and things. So there's also a spot on there that you can ask questions as well. Now, immunisation is provided by the council, and it's provided with the National Immunisation Schedule. So in Victoria, you are required to present your immunisation history when you start childcare, and they do have the no jab, no play. So in childcare, they do want you to have that immunisation. Kindergarten and school, they will accept you without immunisations. However, it is always remembering that if there is an outbreak of anything, you will be asked to not attend your sessions because you have got, your child is at greater risk of contracting the disease and then spreading it through the community. Now, we're currently still seeing our immunisation nurses are still working, and this is a photo of some of our lovely nurses. They are providing the community with their immunisations and doing it while practicing safe distancing. All of our immunisations are booked online at the moment, and they are only having at least 3 people come in at once. So it's all very safe to go and get them done and keep up to date. The other important thing is immunisation is free to all children under the age of 5. So you don't need Medicare. And so if your child is 4 years and 11 months, they will still get their immunisations for free. So it's worth just remembering that as well. Now, some of the things that we will be supporting you with are your sleep and settling. This is always one of our probably biggest concerns for parents is, how do I get my baby to sleep? So we're going to guide you of ways that we can help to get your baby to sleep longer. And in Monash, we're really lucky we've got our sleep and settling program, and they're still operating at the moment via telephone calls to families that have greater needs for having some sleep and settling. We're also going to be offering some baby sleep talks for babies between 4 weeks and 6 months of age. So we're still trying to set those up. It'll be a platform similar to this, but it is in the background to be set up soon. Breastfeeding or feeding our babies is another big concern for most parents. So as maternal child health nurses, we've had lots of experience in breastfeeding, and we're going to encourage you to breastfeed because we know that's the best nutrition for your new baby, but we know it's not always easy. So some of our nurses have actually completed another form of education and they're lactation consultants. At the moment, they are offering phone consultations for these as well, and some are offering some half an hour face-to-face time for those mums that are really struggling with their breastfeeding. We also know that not all parents are going to breastfeed, and they do wean to formulas. So our service is going to help you to talk about how you increase the amounts, the correct preparation of your chosen formula as well. We're also going to be talking to you about your child's development, and we give you a lot of anticipatory guidance of what the next stage is and what to expect is going to happen, and things you can do to help with that brain development. So this is, one of our little babies here doing some tummy time. So tummy time's a really important thing to start with, and we're going to be talking to you right through about each stage. Now, if we have any concerns about your baby's development, we don't actually diagnose that there's an issue, but we will refer you to your physiotherapy, occupational therapist, or speech therapy. At the moment, a lot of these are doing phone video links and things as well. So, and this is just to watch this space to see how much FaceTime contact time they'll be able to have. Now, we will refer you to your GP or paediatrician as well if we do have any concerns. But while everything's normal, we keep you under our banner and keep looking after you. Communication is also really important. So the more you talk with your baby, the better it is. Parents who talk to their young children are using lots of different sounds and lots of words. And so children are hearing, the more words they actually hear, it helps them to improve their understanding of their language and increases the number and variety of words they use and understand. Sometimes we think they're not actually understanding what we're saying, but they will come out later on and you think, I haven't said that word for a long time, because it's all being stored in their little memory banks. So talking with your baby helps their brains develop and can help children do better at school when they're older. So make sure you're reading, singing, and talking about everyday things to your babies. And you can see in this photo here, this is a really good position to have your baby in when they're reading, because they're watching how you're turning the pages and they're looking at what's actually on your page. The other thing that we also remind you is speak the language you know best. So it's really important for your child to know your own language, and children can actually tolerate being multilingual. And how lucky are they to learn 2 or more languages by the age of 5? Now, when you come to the centre, if you're English, if you require an interpreter, at the moment we're doing phone interpreters, but once we can see you face to face again, we will be able to organise an interpreter if you need it. So your nurse is someone that you'll be able to talk to about anything related to you or your child's health. Now, when I say you or your child, I mean both parents here as well. So we have our enhanced nurses who are able to provide extra, more intensive support to our vulnerable families who are experiencing some extra difficulties with their parenting or risk of harm to their children. So as I said here, we're talking to you about your health as well. So your local nurse will talk to you about your mental health. They will discuss things like postnatal depression, family violence, and how your relationship is changing now that you've become a family of 3 or more. So this is how you contact us. So remember, we're only a phone call away. So if you have got a child that fits into our parameters and haven't seen a maternal child health nurse, please give us a call and we can arrange to have an appointment with you and your family. So this is the number for the Monash City Council, and we're open there Monday to Friday 9 to 4. I've also just added a few extra councils that are around the Monash Uni, so you can contact them as well.
Thanks, Leanne. If you don't live in the City of Monash area, then you can find your local council via this website, where you can track down your maternal and childcare services in your area. If you need to put your child in a childcare centre, this website is an excellent website to find your local childcare. You can visit this website to learn more about childcare at Monash. There may be a waiting list. There's also a link there where you can find parenting rooms on campus if required. Baby Centre Australia is a very resourceful website about pregnancy and parenthood. If your finances have been impacted by the COVID-19 pandemic, you may be eligible for the Student, Compassionate and Hardship Package from Monash Uni. Visit this website for further information to check if you're eligible. English Connect runs a Partners module. This is designed for partners of research students. This is a great way for your partner to make friends with others. Monash Graduate Association, MGA, has a parents group and also relevant information for students who are parents. You're welcome to join our Friends and Families MU 2020 Facebook page as an opportunity to connect with other couples and families at the university. Thank you for watching our pregnancy information webinar. If you have any questions, if you need help with anything, or if you would like a list of useful links to prepare for pregnancy and parenthood,